Something we see a lot is people coming in with pain, tightness, soreness up here in the neck, the cervical spine region. And if you think about it, as Americans, we're always here, right? On our devices, on our phones, on our laptops, maybe we're driving, but we always have this forward shoulder, rounded shoulder, forward head posture. And a lot of what manifests itself as symptoms up here at the neck can really be traced back to what's going on with our thoracic spine, with our scapula, our shoulder blade. So today I'm gonna give you 5 things you can do at home to try to open all this up and relieve some of that imbalance up in our thoracic spine and cervical spine area. So let's get started. So whenever I get that tightness in my neck, one of the first things I wanna do is stretch out the chest. I'm gonna use a PNF cycle, which means we're going to contract and relax the muscle to try to get a deeper and better stretch. What I'm gonna do is place my hand on the wall behind me here. I'm gonna use my same side leg to step forward. I'm gonna start to turn away from that wall, getting a good stretch through my pec and maybe a little bit of the bicep. I'm gonna hang out here for about 20 seconds, focusing on breathing nice and deep, telling my body to relax. And then after about 20 seconds, I'm going to contract the muscle, which means I'm gonna push my hand into the wall. I'm gonna focus on holding that for about 5 seconds. Then we're gonna breathe out, and we're gonna relax the muscle. And then you'll see that as we do that, we're able to get a little bit more motion, and I'm able to twist away a little bit more. Maybe we'll do this 3 times and then switch to the other side. So that's number 1. All right, number 2, I'm coming to the floor with my foam roller, and we're going to do some extension work. So I'm gonna take the foam roller, and I'm gonna put it right behind my shoulder blades here. I'm gonna place my hands behind my head. I wanna spread my elbows out wide. Again, trying to open up that chest. And then we're going to extend back over the foam roller and come back down, trying to control that motion and trying to get as much extension as I can as I keep those elbows far apart. And we'll hang out here for maybe a minute, just trying to get more motion each time. And this is really gonna help open up some of those anterior muscles, sternocleidomastoid, pec minor, pec major, all of that that's pulling those shoulders and that neck forward. We're going to stretch that out with this right here. All right, number 3, we're going to work on some thoracic spine mobility with some rotation and some side flexion. So what I'm gonna do is I'm gonna bring my hands behind my head, and I'm going to start to rotate and find where I stop. From there, we're going to add some side flexion, bring my elbow here down towards the table. Again, focusing on breathing nice and deep. When I use that diaphragm muscle, it's connected to the vagus nerve. We're signaling our rest and digest parasympathetic section of our nervous system to tell our body to relax and release tension. So we're gonna hang out here for about 30 seconds. After that, we're gonna come back up, and you'll find that you'll be able to get a little bit more rotation through that thoracic spine. Maybe we'll do this a couple more times and then flip over and rotate the other way. Okay, for 4 and 5, we're coming down to the floor. We're gonna start with some scapular push-ups. So I'm going to come here with my hands under my shoulders, and I'm going to work on some movement without my elbows, just using my shoulder blades. I'm gonna pinch my shoulder blades together, and then I'm gonna pull them apart. So you see what I'm doing here is it looks like I'm dropping my torso towards the floor and then lifting it back up, but I'm not bending my elbows. So again, pinch the shoulder blades together, pull them apart, and we're working on really controlling and stabilizing our shoulder blades, our scapula. We wanna do this maybe for about a minute or 2, working on getting good control all the way through a full range of motion of what we call protraction and retraction. Number 5, we're coming to the wall. I'm gonna get into a half kneel. So I'm gonna put my inside knee up, and we're just gonna do some open books on the wall. So I'm gonna place my hands together in front of me, and we're slowly gonna start to rotate through and see if we can reach all the way out to the other side. I want to get maybe 8 of these before I switch over. Another version you can do, I love this one, is you take your moving hand and you're going to draw a big arc above your head until you flip on over to the other side. Try to draw a nice big half circle each time, and then we'll rotate and repeat on the other side. So those are 5 things you can do If you have a lot of tension in your upper body and your neck, sometimes just opening up that thoracic spine and stabilizing the scapula in that retracted position instead of here where we're all crunched up and forward can really relieve a lot of that pain and tension. See you guys next time.